In his key NHS speech on Monday, Keir Starmer promised that by spring 2029, 92% of patients waiting for planned care in England would once again be treated within 18 weeks, as they were meant to be. But in reality, only 6 in 10 are. This elective reform plan will deliver on our promise to end the backlog, the Prime Minister declared, as he outlined initiatives to deliver on that pledge as a key part of his turnaround plan. Here we detail the key elements of the plan and assess their chances of success. The innovative element of Starmer's plan is that around 170 CDCs will be open 12 hours a day, 7 days a week, wherever possible, to increase the number of tests carried out. Even if it does happen, however, it would still fall into the category of helpful but not game-changing when it comes to making a significant dent in NHS waiting lists, said Siva Anandachiva, principal analyst at the King's Fund Research Group. Only 10% of CTs and MRIs are performed at CDCs, despite them having been around for years, and experts believe progress on their rollout has been slower than expected, the Health Service Journal reported in November. More surgeries are being performed at surgical centers. Again, these centers have been around for years, and more than 100 have opened. These specialist facilities typically perform routine procedures such as cataract surgery and hip replacements. Under the elective reform plan, 14 more centers will open in hospitals by June, and 3 more will be expanded, allowing more surgeries and earlier treatment. Are they effective? The evidence suggests yes. The centers allow NHS trusts that host them to carry out 22% more surgeries than they would without them. This is largely because the centers are separate from the rest of the hospital and have their own beds and staff, so routine surgeries there are less likely to be cancelled due to a lack of beds. Under the new plan, private companies will provide NHS patients with around 1 million extra outpatient appointments, diagnostic tests and surgeries a year, on top of the 5 million they already provide, the independent healthcare provider network said. A 20% increase in activity could mean they would receive an extra 2.5 BN on top of the 12.3 BN they already receive from the NHS and the Department of Health and Social Care. The NHS in England has used private healthcare providers to treat patients since Tony Blair's Labour government pioneered the approach in its NHS plan in 2000. Governments since then have increased the NHS's reliance on for-profit operators to treat NHS patients, paid for from the service's budget. That's been tried over and over again, says Anandachiva. The fact that the NHS is busier now than in 2000 means it is likely that patients seeking to exercise their choice of location will face a choice between a long wait at Hospital A and a long wait at Hospital B. I'm skeptical that it will make much difference to how long people wait.